Hi, everyone. Welcome to the Advocacy Branch's Expanding Access to Healthcare One-on-One Speaker Series. For our first session, we're so excited to feature Lee Che Leong, who is a Senior Policy Analyst at Northwest Health Law Advocates, located in the PNW. Northwest Health Law Advocates, or NoHLA, has been at the forefront of advocating for improving access to healthcare. And some of their accomplishments include advancing reproductive health equity and facilitating easier access to Medicaid. We especially want to highlight their work regarding the Affordable Care Act. So Section 1332 of the Affordable Care Act permits the state to apply for a special waiver to pursue innovative strategies to provide residents with affordable and high-quality health care. And NoHLA was instrumental in getting the 1332 waiver from Washington, approved by the Department of Health and Human Services to expand insurance coverage for all Washington residents, regardless of their immigration status. And this is a historic achievement, as Washington was the first state to accomplish this amazing milestone. So I'll give Lee Che the floor, and I can't wait to hear all that she has to say about her work.
Thanks so much, Sarah, and thank you for inviting me to share our experience in Washington with the Asian Pacific American Medical Student Association. I'm really excited to talk about expanding healthcare for immigrants and what we did with the 1332. I am getting an internet warning again, so I'm going to turn off my video, but just really excited to be here and really excited to share the progress that we've made. So as you can see from this timeline, advocacy often takes a little while. NoHLA has worked for over 2 decades to achieve a healthcare system in which all Washingtonians receive quality, affordable healthcare, and to advance health as a human right. Advocacy is often a laborious process and one that requires real persistence. And we are super excited to share the work that we've done most recently. So the first question when thinking about advocacy is, who are you targeting? Anyone can have an idea for a bill, but you really need a lawmaker to sponsor that bill and ideally co-sponsors to help support it. The legislative process has many parts. There's an initial hearing at the committee level in the first chamber. Getting the elected officials on that committee on your side is key, so it will pass out of that committee and move to the floor. When it's time for floor debates, you need to line up supporters. If the bill passes, then you repeat the process with the second chamber. So if all goes well, the bill will move on to the executive for a signature. In Washington, that would be our governor. And it's great to celebrate when you have a bill passed, but there's still many steps involved in implementation. And that's really where the rubber meets the road. So as you as future medical providers know, instructions to patients don't always translate. So Northwest Health Law Advocates really does engage with all 3 of these categories of decision makers. Healthcare is complex, so advocacy often requires multiple meetings with each elected official and negotiations with all 3 of these categories. So creating change really does require figuring out what you have the power to do. And often talking about complex issues to a variety of audiences is how you build that power. So you can organize lots of people. You can petition and email and call your elected officials. You can share stories in the media, share stories with legislators. You can do that through testimony. And you can also volunteer and donate. When you meet with your elected officials, I'd encourage you to wear your white coats because you're experts as providers. It's important that when you speak out, you leverage your credentials. Complexity is a challenge for comprehension, but frankly, cost is the primary challenge. For example, this year in Washington, we learned that the state expects a decrease of over $1 billion in revenue over the next 4 years. So that made this legislative session fairly uphill, but I think one of the most powerful ways to counteract that is to talk about the human costs as well. So one of the most recent tragic illustrations of human cost has been the global pandemic that we've all experienced. Frankly, it's highly unlikely Washington would have taken the steps that we have toward expanding healthcare without the tragic human cost that we faced as a country and as a state. We also know that people of color bear a heavier burden due to systemic inequities. This chart really emphasizes why data disaggregation matters. As you can see, for Native Hawaiian and Pacific Islanders, those communities suffered almost double the death rate of other indigenous populations. They suffered over double the death rate of people who identify as Latin. Also, they had almost 3 times the death rate of people in the Black community, and well over 4 times the death rate suffered by white and ethnically Asian communities. So it's really important when we talk about the human costs to keep in mind who's bearing the worst of those costs. So the 1332 was part of a broader strategy here in Washington state. In 2021, during that session, we started off with a very ambitious policy bill that set a goal of parity across income levels. That was our vision. That was what the community coalesced around. That bill didn't get a hearing, but it did start a conversation with legislators. And that conversation allowed Northwest Health Law advocates to build on a parallel advocacy effort to add state subsidies to our state exchange in a way that was ultimately very productive. So last year in 2022, the legislature directed our state agency, the Health Benefit Exchange, to apply for a 1332 waiver that aimed to expand access to all Washingtonians. This year, we got funding to start both that program and also a Medicaid-like program. So it took many years. We've still got room for improvement, but being persistent and keeping an eye on the greater goal and continuing to work on that goal has been really key. So who are we trying to help? In Washington state, we, as part of the rest of the United States, endure the same federal restrictions that limit access to affordable health coverage for people who are undocumented. In Washington, that means almost 25% of the people who were uninsured in 2019 lacked federal immigration status. In 2019, it was estimated over 105,000 undocumented Washingtonians lacked health insurance or health coverage. Of those numbers, over 29,000 are adults with incomes up to 138% of the federal poverty level. We also know that just under 35,000 of those individuals had incomes between 139% and 250% of the federal poverty level. So those numbers are going to become relevant as we move forward. So who is uninsured in Washington? Well, as you can see from this chart, it really does vary based on race and ethnicity. This chart also underscores the importance of data disaggregation because, as you can see, Asian and Pacific Islander is lumped into one group. And based on this chart, things don't look so bad. But as you may recall from the prior chart around COVID deaths, those numbers are very different within the different ethnic groups of that broader category. So collectively, the Northwest Health Law advocate staff and staff from a number of different community-based organizations and advocacy organizations collaborated to focus in on this multi-year campaign. We've been guided by a community-informed approach, and the goal is to prioritize equitable access for people who are uninsured and underinsured due to those federal restrictions. What does that look like? Well, there are specific areas of health coverage that are missing. This chart illustrates that there are certain types of care on the left-hand side that are accessible to everyone in Washington, including people who are undocumented or not qualified, which is a federal term. And that includes the population that's eligible for DACA. So while everyone can access those categories furthest to the left, low-income residents have access to some things based on their income levels. So in Washington state, regardless of income level, people can access Medicaid, which we call Apple Health, for kids, for pregnancy or a year postpartum, and certain types of family planning. They can also receive free or reduced care at hospitals and clinics. Washington state has a strong charity care law, and there are programs that help with specific health conditions. In addition, there's emergency Medicaid, which only covers specific types of emergency care. On that list of options in the gray section, those are things that are really limited based on immigration status. And pointing to that box on the lower right, citizens and those who are lawfully present, qualified, and not subject to the 5-year bar have access to Apple Health for adults and health plans with financial help. And that's what we wanted for everyone in Washington, and what we still want for everyone in Washington. So who's missing from the population that can access those things? Well, primarily people of color, as you can see from this chart. The vast majority of people who are undocumented in Washington state as of 2021 are people of color. 43% are Asian or Pacific Islander, 39% Hispanic or Latin. An additional approximately 5% are non-Hispanic single race or non-Hispanic mixed race, and only 14% are non-Hispanic white. So that question of how do we make things more equitable and how do we change things is important to consider, and it's also important how different that graph looks from the population of Washington state in general, where we're a state where almost 70% of the population is white, non-Hispanic. So that brings us to the 1332 waiver. The Affordable Care Act did a lot of great things. It also explicitly said that undocumented individuals, including people who have DACA, cannot currently access marketplace exchange coverage. While states can ask for flexibility from the federal government to make better policy choices for their state, according to Section 1332 of the Affordable Care Act, most states, all but Washington, have used that for reinsurance, which is really designed to stabilize the insurance market. These 1332 waivers are areas where states can make different policy decisions, but Washington state really wanted to expand the ability of all people in Washington to access health coverage. And we received our approval in December of last year and are really excited to be able to make that promise more of a reality this autumn. So before we get there, the 1332 waiver is not a blank check. There are certain guardrails that need to be met. So the federal government wants to make sure that at least as many people would be covered after they grant the waiver as the population that would be covered if the waiver didn't exist. They also want to make sure that coverage continues to be affordable. So we want to avoid excessive out-of-pocket costs, and we want to make sure that we're maintaining the same quality in terms of affordability. We also want to make sure that coverage is as comprehensive as what would exist without the waiver. And finally, the federal government really wants to make sure the federal deficit doesn't increase when they grant a 1332 waiver. So Washington meets all four of those guardrails. We anticipate in 2024 that several things will improve for people in Washington state. The first is actuaries for the state estimate that approximately 2,600 individuals would purchase qualified health plans through our state exchange. So that means more people would be covered with the waiver. It also meets that comprehensive coverage guardrail because everyone has access to the same plans. Washington estimated that there should be approximately $1.71 million in federal savings. The federal government said, we're not really sure you're going to have even that small amount of savings, but we don't expect you to cost more than you cost more to the federal deficit than you would without the waiver. So the waiver was approved and allowed to move forward. And finally, the estimate was that there should be a reduction in premiums for everyone. Everybody benefits, approximately a 1.4% reduction, so fairly modest, but still meeting that affordability guardrail. It's also important to note that these numbers were drawn from Washington's original 1332 application, which was submitted last year. We are expecting new estimates from the Health Benefit Exchange here in Washington. As many as 5,000 or 6,000 people might be able to get coverage, though we are keenly aware that's still well below the 105,000 people that are estimated to be undocumented and uninsured in Washington. We also want to emphasize that privacy was an important consideration for communities engaged in this advocacy, and Washington's 1332 waiver does have privacy protections. Basically, the exchange is only going to pass along aggregate information to the feds. And this information, none of the information collected, can be used for immigration enforcement. So it was really important to community advocates to have those safeguards in place. So what improvements are we expecting thanks to the 1332? Well, the good news is that starting with coverage for January 2024, everyone in Washington, including those who lack federal immigration status, will be able to access state subsidies. That's the Cascade Care Assistance that's shown to the right of that chart. So the column outlined in red shows that people up to 250% of the federal poverty level across the board will be able to access those premium assistance subsidies. You may also notice that, unfortunately, undocumented folks remain ineligible for federal premium assistance and federal cost sharing. So we know that there will be a significant difference between the premiums that people who are undocumented will face, and as compared to people who are citizens or who are lawfully present. Now, I mentioned there were two pieces that we were excited about in Washington State from this legislative session. The first is that every Washingtonian will be able to purchase health coverage starting this November for plan year 2024. And that those up to 250% of the federal poverty level will be able to access state subsidies. In addition to that, undocumented immigrants with incomes that are below 138% of the federal poverty level will be eligible to apply for our state Medicaid like program in July of next year. Unfortunately, that funding is currently capped, so we do anticipate that more people will be eligible than that funding will actually be able to cover. So we expect to continue to do more advocacy to make sure folks have access to coverage. That second piece is visually demonstrated in this chart. So we expect that undocumented immigrants will be able to access Apple Health for adults, because kids already have access to Apple Health, but adults up to 138% of the federal poverty level will be able to access that Medicaid-like program. You may also notice there's still a zero on this slide, and that's because lawfully present non-qualified individuals will not be able to access the Medicaid-like program. However, they do have access to federal subsidies and state subsidies for those qualified health plans on the state exchange. So they do still have access to coverage options, but we hope to address that disparity in the future. So what does this look like timeline-wise? Well, right now, Northwest Health Law advocates and other community organizations and stakeholders are having conversations with state agencies around implementation. There are still lots of unanswered questions. We're still working on the enrollment process. We're talking about the need for a wait list. We have questions about how contracts with managed care organizations will be developed, but those conversations are ongoing. This month, the Health Benefit Exchange actually has a comment period regarding their premium assistance program. And we also anticipate there will be a privacy webinar that will be open to the community sometime this month. So that's in anticipation of November 1st, when everyone in Washington will be able to sign up for coverage on Washington Health Plan Finder for January 2024, regardless of their federal immigration status. We're also excited that people up to 250% of the federal poverty level can get state-sponsored premium assistance, regardless of immigration status. That coverage, as I said, can begin January 1st, 2024. This spring, we anticipate continuing advocacy to make sure we can get full funding and also improve affordability. Next July, we anticipate that undocumented Washingtonians who are adults with incomes up to 138% of the federal poverty level will be able to access that Medicaid-like program. So that's what we're looking at here in Washington State. I really appreciate you letting me share all that information and would be happy to take any questions.
Oh, thank you so much for sharing your knowledge and work with us, Lee Che. As on behalf of all APAMSA members, who are mostly comprised of pre-medical students, medical students, and some physicians working towards expanding access to healthcare, and there's a lot of people that want to be involved in advocacy where it pertains to Asian American health, Pacific Islander health, or even in your realm of expanding access to healthcare. Do you have any tips on how to use our positions as students or medical providers to advocate for change in the policy space?
That's a great question. I think that as providers or future providers, you're in a very powerful position. I think when you work with patients, in all likelihood, you're going to encounter people who have challenges in accessing healthcare based on their federal immigration status. And just being mindful of that, being mindful of which of your patients have less access, and being mindful of the policy landscape that creates those challenges is important. Educating yourself, educating your elected officials, and engaging with trying to make progress, I think is really important. The work that individual providers do with their individual patients is incredibly important. But there are also systemic questions that, as providers, you have a lot of authority when you weigh in on, and I'd encourage all of you to do so.
For sure. Thank you. Yeah, that's all the questions we had. Thank you, Lee Che, again for taking the time out of your day to talk with us about your work at NoHLA. And I'm so excited to make this recording available to all our APAMSA audience members, and this will be all accessible on the website as well. As we wrap up, I encourage everyone viewing the recording or with us on the call to reflect on the key points that Lee Che touched on about advocacy, policy work, and using our positions as medical students or potential future providers to work for causes that we care about. Thank you, everyone.
Thank you.